me, you do not want to miss this video, because in today's video we are talking about 5 chronic diseases that are named silent killers. And it's because you might have them and don't even notice it until it's too late. So, if you want to know more about these diseases and how to detect them early, stay with me until the end of this video. Let's go! Chronic diseases are long-term health conditions that can last for a lifetime. They often creep up quietly, which is the reason that we call them silent killers. The World Health Organization reported that chronic diseases like heart disease, cancer, chronic respiratory diseases, and diabetes are the leading cause of mortality worldwide, accounting for 63% of all deaths. But many of these conditions start without noticeable symptoms. Let's talk about them one by one and see if there is symptoms that we should be alarmed about. The first chronic condition that we are going to talk about is hypertension, also known as high blood pressure. Hypertension is able to act silently within the body, gradually harming your arteries, your heart, and your other vital organs without overt symptoms. But still, there are some indicators and implications that in case you have a couple of them, you can be concerned and get yourself checked up. The first symptom that you might notice if you are developing hypertension is headaches. Headaches due to high blood pressure are often described as occurring at the back of your head, and you mostly experience them in the early morning upon waking. They can vary in intensity, but most of the time they have a pulsating nature. The next symptom that you might experience in case of high blood pressure is dizziness. You might notice sporadic spells of dizziness or lightheadedness as a subtle sign of high blood pressure. Along with your other symptoms, you might experience shortness of breath, and this symptom is really worth noting if you experience it while doing your routine activities. Some other symptoms that are not really common, but still they might happen, are blurred vision and nosebleeds. Blurred vision stems from the pressure-induced damage to the blood vessels in your eyes, and unexpected nosebleeds can arise from prolonged high blood pressure. The research shows that a great percentage of people who have high blood pressure are not diagnosed. And this is why by early detection you can prevent yourself from getting heart failure, stroke, kidney problems, and vision problems. So if you have one or a couple of these symptoms, make sure that you see your doctor and get your blood pressure checked up regularly. The next silent killer that we're going to talk about is type 2 diabetes, which is characterized by your body's inadequate response to insulin. Insulin is a hormone in your body that works by regulating your blood sugar, and it also helps your cells to be able to consume the sugar from your blood. Now, in case your body doesn't respond well to this hormone, or it doesn't produce enough of this hormone, there will be an unhealthy level of blood sugar in your body. And that's where diabetes starts to damage every single organ in your body. Now, there are some early signs that you might experience, but might as well ignore them. The first symptom that you might notice if you are developing diabetes is consistent thirst and hunger. Consistently feeling parched and unusually hungry, even post meals, can be an early alert. Frequent urination is another symptom, especially if you find yourself often waking up during the night just to urinate. Chronic fatigue is another sign. So if you're constantly exhausted and it doesn't go away even by getting enough sleep, well, this can be a sign. Another thing that you might experience if you have diabetes is slow healing wounds. A notable delay in recovery from injuries is often linked to poor blood circulation and elevated blood sugar levels. Another sign, which actually is not an early sign but you still might notice it, is tingling sensation in your extremities. So if you have this tingling sensation in your hands and your feet, it can be an indicative of the start of diabetic neuropathy, which is a nerve complication in diabetic patients. So We are all aware that diabetes can affect all of our organs, from our heart to our kidneys. So it's very important to detect it early and prevent all of these complications. So if you have one of these symptoms or even a combination of them, make sure that you see your doctor and get your blood sugar checked. The next chronic condition on the list is chronic kidney disease. Our kidneys are the vital organs that are tasked with filtering and eliminating waste products and excess fluids from the bloodstream. Now, although chronic kidney diseases can have very intense systematic symptoms in case they are advanced, in early stages, they are quite silent. But still, there are some general symptoms that if you take them seriously, they can help you detect chronic kidney disease in early stages. The first symptom is nausea and vomiting. A recurrent sensation of vomiting, especially if it is without an explained reason, can be a sign. It happens because your kidneys cannot eliminate the waste products anymore, and they accumulate in your body and cause you to feel nauseous. This nausea and vomiting can also coexist with a reduced appetite in a way that you don't feel well and don't feel like eating. Now, when you are developing chronic kidney disease, the excess fluid cannot be eliminated from your body and cause you to have edema. This swelling can be particularly noticeable in your ankles and your feet. And having so much waste product in your bloodstream can cause you to have pruritus or persistent itching. Something else that you might notice, especially at nights, is muscle cramping or twitching. Early diagnosis of chronic kidney disease can prevent complications like anemia, bone disorders, cardiovascular disease, and eventual kidney failure and the need for dialysis. So, you know what to do if you have any of these symptoms. Just visit your doctor and get a checkup. The next chronic condition is osteoporosis. Osteoporosis is a chronic condition where your bones get weak and brittle. And this happens because of a decrease in your bone density. Scientifically, it happens when the balance between your bone building and your bone breakdown is disrupted. And this leads to more bone being lost than formed. And this makes your bone more susceptible to fracture, even from a minor fall or stress. Now, the problem is that osteoporosis, such as other chronic conditions that we mentioned, often happens without overt signs. So you might want to be more cautious about some of the general signs that might be indicative of osteoporosis as well, just to catch it in early stages. The first sign that you might notice is back pain. Now, the back pain that comes from osteoporosis is often associated with a fracture in your vertebrae. Therefore, it usually has a sudden onset, possibly after a minor fall or a sudden movement. Your pain is often localized and it can be pronounced by certain movements. Now, the next thing that you might notice is gradual loss of your height. Now, if you have multiple vertebral fractures, by the time they can cause your height to be reduced. Another thing that you should consider as a sign is unexplained bone fractures. This is about instances where minimal stress can cause a fracture in your bones. Now, another thing that I want you to be aware of is a pain in your wrists and your hip. This type of pain can be a hint at an unnoticed minor fracture. Postmenopausal women and elderly are the people at higher risk of osteoporosis. So, if you are at higher risk of osteoporosis or you have one of these symptoms, make sure that you do the bone density scans, because early detection of osteoporosis can help you begin the treatment at early stages and prevent a lot of future complications. Now, the last chronic condition that we are going to talk about is glaucoma. Glaucoma is a set of eye conditions that can damage optic nerve, which is crucial for our vision. And this damage is often caused by an increased pressure inside of your eye. It is actually a very important condition because the World Health Organization identified glaucoma as the second cause of global blindness. The problem with glaucoma is often its gradual and silent progression. The signs that you might notice if you have glaucoma are gradual loss of peripheral vision, tunnel vision, blurry vision, or seeing halos around lights. Now, something that you should definitely consider is that the risk of glaucoma increases with age, especially after 60. Also, if you have conditions like high blood pressure, diabetes, and you have a family history of glaucoma, you are simply at higher risk of glaucoma. So it's been suggested by different research and professionals to do routine checkups if you have these risk factors or these symptoms. Alright, thank you guys for watching until the end of this video, and I hope that you learned a lot. Don't forget to like and subscribe, and until the next video, bye!